14 years ago, when my son was 6 years old, he ended up getting type 1 diabetes. It's been a struggle all these years, and it was even more so. My husband decided at 66, Laurie Benoit. My husband at 66 decided that he had to retire, which over the years we'd always looked at, there would come this point, and we've looked to try and get insurance for our son for many years until Obamacare came into existence. They wouldn't even look at us. My son with type 1, and they'd go, nope, sorry, pre-existing. He finally this year, he went a couple months without insurance, with having dependent on insulin. We did have to take him in. We did have to pay for that. We were worried what would happen. He still doesn't have a diabetic doctor, still hasn't gone to for any medical care, because he's still trying to figure out what and who we can go to, because he has to switch doctors. I think over the years I was a mental health worker, worked in Portland, and I saw the same struggle with people who had mental health issues. This issue has not gotten better. Generally, it's better under having something, because we are able to get some kind of insurance, but it's still, having a card without having a doctor isn't going to do you any good when you have to go in and pay for it anyway. We're in a situation where if he doesn't get something, you have to maintain when you have a chronic disease like that, you have to help maintain that person through through mental health, through a doctors, through services, as well as through family and support. And that's what I have done over the years as being employed in the mental health field. Otherwise, what happens is they fall through, and let me tell you, it costs a lot more money to try and keep that person stable rather than to let them deteriorate to the point where they need hospitalization and long-term care. And I see that this Obamacare, this affordable care, is just something that's just a Band-Aid that'll get us through. We're struggling. It's still better than it was, but it's not as good as we had hoped, and there still are too many flaws in this system. And my husband being retired, we pay over $500 for mine. It was going to be a wash whether it go Obamacare or go with my husband's employer. And we did go with my husband's employer, but still it's costly. And then, like somebody else said, you go in, you have to pay copay, and there's still all these other costs associated with that.